My name is Deborah Robin, and I'm the Executive Director of Jane Doe, the Massachusetts Coalition Against Sexual Assault and Domestic Violence. I want to talk about the intersections of health and violence. I'm really honored to be here today and really grateful to get a chance to speak. And I want to thank Congresswoman-Elect Ayanna Pressley for your proactive, wherever you went, leadership and bold leadership on these critical issues. We are the only statewide membership coalition in Massachusetts, and our 57 member programs across the state work tirelessly every day to prevent domestic and sexual violence in their communities. Their work saves lives. And together with our other state organizations and national partners, we are working on progressive policies that are desperately needed to prevent sexual and domestic violence.
That's right.
Here's what we know. Domestic violence is the most common killer of women around the world. Yes. The UN just reported the most dangerous place for women is in their own home. Guns are the most common weapon used to kill women in the U.S., and here in Massachusetts, despite our strong laws, in 33% of domestic violence homicides, the most consistently used weapon is a gun. But these statistics only paint part of the picture. We have to apply an intersectional lens in order to really understand more.
Yes.
In 2015, in the U.S., 58% of black female victims were shot and killed with guns. The number of black females shot and killed by their husband or intimate acquaintance was 4 times as high as the total number murdered by male strangers using all weapons combined by a single victim or offender incident in 2015. The U.S. Centers for Disease Control reports that black women experience the highest rates of homicide of any racial group in the United States. Black women are disproportionately affected by both domestic violence and domestic violence homicide. These disparities extend to the structures in our systems that reinforce injustice, racism, and other forms of oppression that impact available resources and our responses that are so limited and over-rely on the criminal justice system. Sexual and domestic violence are equal opportunity oppressors. They affect individuals and communities everywhere. But, and it's a big but, not everyone is impacted in the same way. Black women, women of color, Native women, transgender communities are most at risk, and folks are being harmed and dying every day as a result of the multiple oppressions they face. This is a public health crisis.
Yes, it is. Yes.
As a social justice organization, it's not enough to stop here. Let's look at what is happening across the country and why we need stricter gun control laws in the face of almost weekly mass shootings in every state practically in the country. There's one element that we don't talk about enough in most reports, that the majority of mass shootings are related to perpetrating, experience, and or witnessing domestic violence. In at least 54% of mass shootings, the perpetrator, most often a white male, has had a history of domestic or family violence.
That's right.
Is there a stronger case to be made for prevention than these statistics? So what do we need? We need strong laws. We need well-resourced funding for prevention. We need new approaches that centers those who are most impacted the most. And we need the Violence Against Women Act to be reauthorized. To continue this important work of saving lives and even more preventing gender-based violence in our communities. Thank you so much.
That was worth waiting for.
Guys, we'll take just a few questions.